Hello, everybody, and thanks very much for that introduction, Jess. So I want to take you through the toolkit that we've designed for Scotland to help enhance trauma-informed practice. So today I'm going to go over a little bit about the background to the project and the approach that we used, take you through the toolkit, which is designed into 5 categories which cover the trauma-informed principles, and talk about some next steps you might take as organisations or individuals. So to start off with, in recent years, there has been a lot of kind of generated multiple toolkits aimed at helping organisations become trauma informed. The difference with this toolkit is, relatively few of these existing toolkits have been based on survivors and staff's view of what trauma-informed practice looks like in a real-world setting. And importantly, none of the current ones that we're aware of have been based on real-world settings in Scotland. So the toolkit itself aims to address that gap. It's developed to support organisations, departments, teams across the whole of the Scottish workforce, across multiple sectors. And it's meant to be used in conjunction with all of the training that we've just heard about, and those fantastic NES resources for Scotland. Okay, but I think better than me explaining it, one of the GPs that we spoke to, I think, explained the idea of the project so well. They said, I think there's a lot of misunderstanding about exactly what that phrase is and exactly what true trauma-informed care is. And hopefully by painting a very good picture across sectors in something that's easy for people to read, they'll start realising that actually a lot of people aren't doing trauma. They haven't started their trauma-informed care journey. And I think that was the main objective for this project, is to help people really understand what that phrase means and how to make that more tangible for people. So very, very much, I'm going to be whizzing over my slides as well, because lots to cover in the time that I've got. But our approach, so we did a really in-depth scoping phase, looking at literature, searching across multiple sectors, and really in-depth key website searches of some of the main trauma-informed players internationally. And then we identified, importantly, existing examples of trauma-informed practice or trauma-responsive care or practice in Scotland. Okay, so we did that through literature and web searching, but also through the National Trauma Training Programme Steering Group. And through that, we identified some fantastic case study examples that very kindly agreed for us to complete some qualitative fieldwork with staff and service users. And the toolkit is the result of that work. So we didn't complete a comprehensive mapping exercise, but certainly went into some case study areas showing some great examples of trauma responsive practice. So here are the case study areas that we went into. In total, the project spanned 7 sectors, which was great. So we spanned GPs, mental health, residential care, police, criminal justice social work, addiction services and education. And in total, that spanned across 11 sites. And we completed 50 depth interviews. So it's important to highlight that this was happening around, at the time of coronavirus. So everything was on telephone or face-to-face. We couldn't go into the sites, annoyingly. So a lot of what I'm talking about is focusing kind of more pre-COVID. Yeah. So key useful parts of the toolkit before I take you into the toolkit. As I've said, the idea is that it's going to make trauma-informed practice tangible. We've gone into these areas, we've spoken to people delivering it, we've spoken to service users, and we wanted to learn lessons from them. The really important starting point for anyone that wants to use the toolkit is Appendix 1, and it's a list of all of the questions that you can sit down with your team and spend a little bit of time maybe reflecting on. And the tools that kind of link up with that appendix are in Appendix 2. So there's a set of tools which will take you to the places that you need. And it's also worth pointing you to Appendix 8. So there's additional reading by sector, which I think is especially helpful. Okay, so you've seen this slide already, but obviously it's the NES principles adapted from the Harrison-Fallow principles, and the toolkit is based on these kind of five petals and divided into sections. And then we use the SAMHSA implementation domains. I'm not really going to go into these in great detail. It's from their guidance in 2014, but it was just a way, a kind of framework for us to use when analysing the data, and it's proved useful in the actual toolkit. So this is the toolkit. So it was only published the other week. So the toolkit itself, as I said, is presented under the 5 trauma-informed practice principles. So the first principle here is safety. So I'm going to go over each principle, or an example from each principle, throughout the remainder of the presentation. So you can get a really good idea about what trauma-informed practice looked like kind of on the ground across some of these sectors. So safety, the first key principle, really about physical and psychological safety. So a lot of the case studies that we went to really recognised the importance of environment and promoting safety. And where they could, they tried to make the environment as welcome as they could. You can see some of the photos there. And almost carrying kind of a lot of domesticity, making sure that people would feel more at home and less anxious in those environments, and really reducing the clinical feel where appropriate in some of the sectors. And they were doing this by kind of getting pictures or plants, or generally creating an ambient feel. A lot of effort went into this by the staff in case study areas and the service users. It's a team effort, a very trauma-informed approach. And there was a beg, borrow and steal mentality, really. So it was really people bringing in what they could and using whatever they could, whatever they had to hand, and where possible, putting together kind of smaller grants for things like plants, for example. So in each page, you'll see there's a toolkit down to the right, which has got the questions, which is summarised in Appendix 1. So these questions ask a kind of reflective points for you to look at with your team or individually, and then directly underneath you've got the tools that you click on so that you can go to the information. So I've wussed out slightly being able to click on hyperlinks, so I'm just going to show you over slides. So this is the toolkit that you'd be taken to. So on that first slide, you've got the trauma-informed lens. So that takes us down to the trauma-informed lens tools that you'll see is at the top of that page. So it's got access to the NES trauma-informed lens workshops, and then also some of the animations that you saw. So here we go, and that's where you'll be taken to, clicking on the link. So the whole idea is everything is there. You don't need to go searching to different places to find different things, because we know everybody is busy and snowed under. Another really important part of the safety section was psychological safety, and there were some lovely examples again of tools that staff and service providers use to help stabilise people that came into their services, improving that feeling of safety. So recognising that people that have experienced trauma will have more difficulties regulating their emotions, being able to explain why that is to people in a really easily accessible way, and using skills such as grounding or breathing to help people in the services, or potentially using calm boxes, which is what that picture shows there. Oops. I've got a very sensitive mouse. That's not what I want. No, right, okay. So there we go through to, you can see from the tools, that then takes you again to exactly the point that you'd need, which will look at some of the tools that you can learn about that would help explain, why people's brains respond the way they do to trauma, and why people behave the way they do, so that you can then easily explain that to service users. This one's Daniel Segal and his hand model is something that I use quite a lot with people I work with, explaining the basic areas of the brain. There we go. So trust, key principle of trust, again, came out lots in the case study areas. The key point was doing what you say you will when you're going to do it. When that doesn't happen, that's so difficult for survivors of trauma, because it can be extremely triggering. A lot about clarity around boundaries, especially confidentiality, who you're sharing that information with, what the notes that you take are going to, what they're going to say, what you're going to do with them. Any perceived or real breaks in trust can be really re-traumatizing and jeopardize relationships and future engagement. So again, here you'll see there's some tools on asking about trauma. And when you click on that, it will take you straight to a page which will give you more details about asking about trauma. But obviously, there's all of the NES training packages as well. I can't emphasize enough, this is to be used alongside the NES training package. So this slide showing us a bit about choice. So there were lots of different ideas across sectors, but all of them had the commonality of maximising choice. So often survivors aren't given choice, and that can be extremely difficult for them. So even if they're offered a small bit of choice, it can have a really big impact. So there were some examples of this in residential care, where they allowed kids in their care to choose how to decorate their rooms, or in education, they were given the choice to choose kind of how they'd be learning, or different games that they play. And I think what's interesting is that commonality in the fact that those two examples are, examples of environments where there isn't a lot of power potentially for the people in their care. So even offering just a small bit of choice can make a really, really big difference. And for me, that really echoes how things that could inform kind of development in care homes, with working with older adults. So lived experience was key throughout, working out where to offer the choice, as well as forming the physical environment, and as well as key in our collaboration section. So part of being trauma informed is really maximising lived experience. So making sure that there is a real collaboration with the people that have used those services. So the success in this really varied across the sectors, which was interesting. The police actually had a great collaboration that they'd set up with a lived experience group, and they used them to provide trauma-informed training alongside consultancy. And what was interesting about that sector was, I think it was actually the only area where it had culminated in one of these teams gaining paid employment in the post, which is obviously a great way of embedding lived experience in your team, actually making sure that you recruit for it. And there's actually some tools on how HR can do that, and potential interview questions as well. Because this way it would really help to reduce the power differential, which again can be triggering for survivors. Others had existing groups that were already set up, that they utilised really, really well, but really made sure that they were service user led. But it is a challenge. It was recognised that where those groups aren't already set up, it can sometimes be a barrier. But I'm hoping that some of the tools in the toolkit will really help you. So we've got some kind of standard points. If you'd have clicked on, there's lots of getting lived experience links. It will take you to kind of this appendix, which is just kind of good starting points for getting lived experience involved. And within those toolkits, there's also other documents that can really help. So, for example, there's a link to Beth Weaver's Inclusive Justice Co-Producing Change report, which is fantastic advice for criminal justice social work in getting lived experience on board. And there's also kind of another link which goes to the Scottish Health Participation Toolkit, which again is fab. So empowerment, a final principle. So really looking at empowerment of staff and service users. So leadership, something that's already been spoken a bit about, but it was highlighted as being so important, and there is greatness training for leaders as well. But in the case study areas, there was so many findings about modelling and the importance of modelling as a leader. So that's relating to the sort of language that's used. And here you'll see there's a link that you could click on for advice about using trauma sensitive language, potentially setting up a procedure to help people do that. So really modeling the language that you use, framing how you look at things in a trauma-informed way. So it's that question, it's asking what's happened to someone rather than what's wrong with them. And modelling that can mean that other people in your team will also start responding in that way. And I know Elisa referred to it before, but modelling self-care, not sending those emails late at night, taking the lead when you should, looking at some of those wellbeing plans and making sure you're implementing those yourselves, and recognising the importance of workload and making sure that people still have the time to reflect as a team. But importantly, it's not just obviously about the leaders, and it's the same as Lisa was saying. With well-being, everybody's responsible for being trauma informed, and anyone can model this sort of behaviour and make changes in a system. And we found that a lot across our areas. As a link to kind of the National Wellbeing Hub, which we've already spoken about. So next steps, please read the toolkit. It's designed to be an engaging read. There's pictures, there's quotes. I hope you enjoy reading it. And use Appendix 1 to speak to your team and to start looking at how you can move further along on your trauma-informed journey. So that's a quick whiz over of Appendix 1 and the questions that you'd go through with your team. After that, it's really designating a trauma champion or a team of trauma champions. We found in some sector areas, like for example with the police, where people can the team can be moved on somewhere else. It was really, really helpful to not just have one trauma champion. Next part, looking at how to get lived experience on board, such a key part of being trauma informed. Completing NES's trauma informed lens workshop exercise, and obviously familiarising yourself with all of the NES trauma training packages. So I'm still a clinical psychologist at the Rivers Centre, but I'm also a clinical psychologist at the Lothian Staff Support Service. So we're providing support for health and social care across Lothian. So just to make sure that those of you that are Lothian based are aware of Here For You, and please do call us if you feel like you need some support, and we're also offering training as well. So thank you.